Hello, good evening, everyone. I'm Dr. Hina Singla, Program Officer, Vision 2020 India, based in New Delhi. On behalf of Vision 2020 India and Sadhguru Netra Chikitsalaya, Shri Sadhguru Seva Sangh Trust, I welcome you to this webinar on empowering outreach staff and Vision Center technicians, strategies for effective community engagement and service delivery. We will run the session for an hour. Vision 2020 India has been organizing various webinars under its Knowledge Hub initiative. Let me introduce our resource person, Mr. Subesh Kwadil, Head of Center for Community Ophthalmology at Sadhguru Netra Chikitsalaya, Shri Sadhguru Seva Sangh Trust, is a public health professional with over 15 years of experience in eye care management. Thank you once again for your participation. I request Mr. Subesh Kwadil to take on. Over to you, sir.
Thank you, Dr. Hina. And I think in the outset, I really wanted to thank Vision 2020 for this great opportunity. And I also would like to thank my organization, Sri Sadhguru Seva Sangh Trust, both Dr. B.K. Jain sir and Dr. Ilesh Jain sir for this opportunity to represent this organization. So today, like Dr. Hina has very well said what we are going to talk about. So I'm also really wanted to thank the participant who made it possible to attend this session. I can see more than 100 people are here. So I'm thankful to you and I hope I'll be able to give some value addition to your current practices. So primarily, I'll be looking at two important things. One is, as a vision center staff or an outreach staff, what are the some practical insight we can share in terms of improving your community engagement and service delivery. And also I want to talk some insight to the leaders or the managers in the system for those who manage the outreach program. So my presentation is more of giving some insight to the ground level workers like vision center staff and also to the team lead, especially the outreach manager, vision center manager, etc. So whole of the presentation I'll try to focus on these two things and these two cadres. And I really wanted to say whatever I'm going to talk, it is going to be practical. I don't want to go theoretically. I just wanted to give the practical insight we gained through the organization. So I belongs to an organization. I work for an organization. I feel proud in take part in an organization called Sadhguru Seva Sangh Trust. This is an organization who fundamentally believe in community engagement, and all of what we have done so far, it's purely because of the community empowerment and community engagement. So that's how the organization is. And as I mentioned, we are rurally located and very proud to say we are one of the largest rural eye care provider in India now. So, so with that experience we are going to talk about. And if you look at the scale, why I'm showing this, because I wanted to let you know that in terms of empowering community staff, in terms of engaging the community, what does go what can be the scale of success, or what can be the scale of operation. So if you look at the Chitrakoot, close to 1.7 million patient every year we are seeing through our outreach and vision center network, and this is the number of surgery we could do through this effective community engagement and empowerment, 155,000, and this year close to 160,000 we'll be doing. And we're just not focusing on the volume or the numbers. We have one of the state of art quality infrastructure, which is fully NABH accredited. And then in terms of cataract, I just wanted to mention, like, India does the maximum number of cataract surgery in the world. Like next to us, the populous country is China. But then if you look at the total number of surgery we do, China is nowhere in terms of competition. But then in India, if you compare the individual organization across, I'm talking about all over the national level. The Sadhguru does the maximum number of surgery. I mean, the Chitrakoot center alone do 130,000, which is the highest in as a single eye center. So the point I'm making here is through community engagement, kind of empowering your community staff, how this organization could come to this level. And today the network is close to 2 million patient, 217,000 surgery we do. So all of these things happened only because we had a department called Center for Community Ophthalmology. I think every organization success have different strength. For us also, many components are important, including the clinical quality, the clinical division, the research, capacity building, many things. But I think one strong pillar of this organization growth, or one strong pillar which could surge the growth of this organization, is Center for Community Ophthalmology Department. So from that inside, I'm going to talk about everything. So that is where I really wanted to put this background. But here is something we are going to talk on our experience and which substantially help the organization to come to this level. So when I say 155,000 surgery or largest number of cataract surgery volume, all of these things possible because we had a community ophthalmology based driven workforce. So that's how it is. And we today we have 170 plus vision center network, and also we do a lot of surgery. This is the point I was making. Close to 90,000 surgery is, I would say, directly or indirectly supported by the community ophthalmology program. So all of my insight in the coming slide come through our own experience. And just to substantiate, because I said in the beginning, all of you are devoting your time, I would say it is worth, because if you can kind of improve your community engagement, improve your capabilities of community staff, the result are going to be similar like what you have seen in the case of Sadhguru. So I would say today we do a basic door-to-door screening to an advanced diabetic retinopathy screening program also. So the point is, this organization has gone to a level where community ophthalmology or community engagement played a very crucial role. So whatever we have done so far, I would say the community engagement had a very critical role. So with that background, I wanted to talk about these things. Like when I said in the beginning also that end of the day, how do you really motivate a staff who is working in the community? How a outreach manager run their outreach program more efficiently? This is what my talk is going to be, where you can yourself see how Sadhguru has grown from a smaller organization to a larger level, where we could exceed all of the expectation, where you can also see how much the role of community ophthalmology played. So with that insight, I'm going to talk about this particularly. But before I go to that, like, what all we should do to empower, let's really quickly look at the need of empowerment. See, I think when it comes to outreach program, or when it comes to hospital and community outreach program, I think both at individual level and then the organization level, a lot of thing matters. Because if you see, let's indicate, we'll take an example of an optometrist. An optometrist is working in a hospital. Probably, if any mistake or something he make, it can get corrected by a senior, or I mean, you'll have some layers in the organization to cope up with. But if you look at in the outreach, most of them, let's say in a vision center, you have one staff posted there, maybe you will have another staff who's in the field, but at a particular point in time, the vision center is run by that particular optometrist. Totally organization capability or totally the organization trust build, everything is depending on that particular person. So it is very important to become that person is fully capable, competent, and also fully aligned with the organizational principles and policies. So the point I'm making here, empowering a hospital staff or empowering an outreach staff, I think in outreach staff, empowerment has a greater role to play, because if your staff is empowered in the right way, then he will take your organization to next level in the vision center. In the base hospital, probably you have 10, let's say, group of optometrists, one or two people are not really performing. It may not really immediately affect you very badly. I mean, all of us need to be improved, but I think in a vision center, if you put a manpower, if you put a staff who's not capable or who's not aligned with your system, you can really spoil your name in the field. So there, I'm saying empowering your staff become very crucial in the community-based program, be it vision center or outreach program, because it is more of an individual effort at many level. Like let's say when I say we have 100%, or some other organizations say they have 100 plus vision center, it is not in a collective center. Every center matters. But if you come to an hospital where you have 100 staff, probably one or two people are not really performing, it get compensated. Like I say, if the counselor is not talking well, maybe the doctor will cover up, or maybe a senior patient care manager come and run and say that so sorry, this was not supposed to happen, we'll handle it. So somehow you'll have layers to protect your goodwill, your reputation, your factors. But in vision center or outreach program, they are the people, either they do good, or either they will not do good. So that's how this become very important. So that's why I'm saying the fundamental difference between a hospital and outreach program is, you know every staff, like vision center staff, you look at, he has to be good at clinical, he has to be good at people management, he has to be good at problem handling. So how do you prepare, like, you'll have a lot of optometrists who are really good at refraction, probably they are not really good at communicating to patient, probably they are not good at kind of giving information about the surgery. But in a vision center, unlike the hospital where you have specialized people to do counseling, specialized to do people optical dispensing, in the vision center, probably that person has to do everything, and every role need a kind of an equal efficiency. It cannot be like, yeah, I'm good at prescription, but I'm not good at communicating. They have to be. So the whole question is there, or whole idea or whole things go there, how do you prepare yourself as a vision center technician or an outreach camp organizer, or as an organization, how do you prepare your team in terms of matching the community needs? So this is where I wanted to make a stand. Empowering the staff who's working in outreach is really important in this aspect, because this is the person handling everything. So that is the context, so that is the background I wanted to really emphasize to all of you, that you really have to understand the empowering outreach staff is something very substantially important. You cannot take it for granted. So with that, I'll go. So now, once it is very clear that the strategies has to be the, or the empowerment of outreach staff is really important, now let's talk about strategy. So how do you really empower? So I just wanted to give you a few insight. I don't want to talk very lengthy, but because as I said, first I said empowering the organization can take organization to different height, altogether, like the Sadhguru story. Second, I said why it is important to empower, because we keep hearing about engaging employees, empowering employee, but in this outreach programs, whatever it be, the program, vision center or outreach program or a diabetic retinopathy, whatever it is, empowering become very crucial, because they become the face and they can make or break your organizational strategy and approaches. So these two things I made it very clear. Now, once we are convinced, okay, I need to empower my employee, I need to empower my outreach staff, how do you do that? There again, I wanted to give some practical insight to you, so that maybe end of the day you can incorporate. And I'm not saying many of you might be doing the similar thing or much better version of what we do, but since the opportunity is me to speak on behalf of the organization, I want to share the key strategies in that aspect. So the first important thing, we are in NGO sector. Many of the time we look for compassion, we, because our purpose is great. I mean, all of your organization have a big tagline, and we do stand for it. We are not a profit making, or most of the that's what I believe. Maybe no, others also might have joined, but I'm saying in general we are really clear with our purpose and vision, so we all have compassion. But I think we need to have competency as well. So, like I say, in Chitrakoot, we do 100,000 surgery every day, but we have state-of-the-art model operation theater. Our Dr. Jain sir and Dr. They always talk about, they don't want to take privilege of being in rural. We wanted to give best class facility to the patient. Similar, like whatever the outreach program you have, you need to ensure qualifications. I mean, qualification is, it's like, you, if the screening has to happen, you need to have a qualified person. Don't compromise on all these things. That is one. Second, you need to bring role clarity. Even I say vision center technician has to do n number of activity, but that need to be really defined. It's not key, whatever it comes, you will have to do. No, you have to have a role clarity. And third, most importantly, you need to ensure there is a continued training and follow up. And bigger organization, like we have a lot of big of close to 250 optometrists, so you have seniors, then junior, then mid-level, so you will have an effective mentoring system, like in our case, those who regularly support. So I think in a nutshell, I would say compassion and competency should go in hand, and we need to ensure all of our people are not just compassionate, they should be competent as well. That's a fundamental one thing I'll talk about. So we are fortunate to have our own school of para-ophthalmic science, where we do train optometrists and we do train ophthalmic assistant. So today they are involved in an advanced screening to a diabetic retinopathy camp, everything. But I think more importantly, you need to continuously involve them. Like in our vision center, basic time, if you remember, we didn't used to have fundus camera there, but now we, most of our vision center are getting equipped with fundus camera. So there you need to ensure they are getting trained adequately. So the point is, you need to ensure comprehensiveness, but how do you really make yourself, your staff is capable to do handle all of these things? So one end compassion, the other end competency. Ensure, even if it is a door-to-door level screener or a community health worker, ensure there is a clear cut qualification, and the role clarity. Based on that, you may train in short term also, not necessary to have a academic qualification at all cases. But I'm saying, you need to, end of the day, you need to ensure this person is competent to do what I'm assigning to them, not go with the gut feeling of they can do it is in the community. That is one thing very important. But not just there. If you look at, like, now this picture is an optometrist, might be very good at diffraction, but if he's not a good communicator in terms of communicating the organizational values, the information about eye diseases, there he will struggle, and probably he might get fed up. So I think there also you need to continuously ensure there is a soft skill development happening for these people. and then how do they really handle soft issues. So that is where another important focus need to be done. I think being in the let's say in the case of vision center, you see the hospital is so comfort, where they might be sitting in a very comfortable refraction cabin and doing the refraction. Now you putting them to field for different activity, including the vision center, outreach camp, door-to-door screening. So how do you really put them into a framework where a lot of uncertainty, vulnerability or come in? So there, you if you equip them clinically, if you equip them in terms of people management, in terms of communication, probably they'll do a better job. And also, as an institution, you need to have a progressive and rewarding framework. I mean, I think this is a typical example. Mr. Mukesh Kare, who is a state program officer for Uttar Pradesh, he joined us to 2000. I mean, like almost 25 years. So now he, from an optometrist running an outreach program, then managing our vision center. I think our beginning vision center 2003-4, he only ran our Atara and Manipur vision center. Today he is heading, he is a state program officer for us, handling all of the outreach program in Uttar Pradesh. So he's an optometrist. So now you see the entire optometry fraternity who is working with us, going to the field, taking responsibility, taking challenges. They see this, that institution also reward you eventually. So that is where, like, when you put them into a very fragile environment compared to a hospital, where they also should feel there is something additional I'm getting out of it. Probably his batchmate may not be here, but he is there because he has given his 100% to the community. So that is where somewhere you need to ensure, when you put them into challenging situation, when you put them into more challenging situation, rather than just doing a reflection, you need to reward them as well. So in terms of employee engagement, I think for the community engagement, employee engagement is really important. And for that, I think every level you need to ensure their opinion also matters. Like, what we do is every 3 months or every 6 months, we have quarterly meeting, quarterly vision planning. All of this planning, these people who are working in vision center, who are working in community as community health work, are actually involved. So it's like, they're being heard. So when they sit, they plan, you're giving them a lot of importance. So that is also very important, taking along with them, so that end of the day they will feel more important, because community engagement is something very different ball game, where I would say the strength we have. So the numbers I talked about, the 117 vision center, the number of outreach surgeries we do, I think all of it happened because we could get a very good support from the community. And community support you will get only through a very structured approach, where I would say keep when usually we talk about partnership, I always talk about this. We talk about what I do and what we'll do. We are very straightforward. But in community, I think when you engage community members, you need to be very liberal in counting their contribution. Probably they have done 10% of what they have done, but you have to probably say ki, we can't do without your involvement. You kind of make them projected. Your role was very critical. And I'll tell you, even if you praise them overly, like if they have done 10% of contribution, but you say they have done an exemplary work, eventually they are going to be there. That the point is, if you engage them in right way, and you being liberal in recognizing their work, they're going to really do the work later also. So because every moment you need to ensure, be it an ASHA worker. So most of the time when you do ASHA worker training and all, sometimes you feel, what is they are going to do? They don't really refer. They have their own priority. But I'll tell you, if you keep engaging them, giving them importance, keeping the communication intact, and it's a regular follow-up, eventually they all coming into your line and support whatever possibly they can. So in the community, you should not really look at a kind of a very crude way, what they do and what in terms of what we expect from them. You have to look at in a long picture how much they are aligned to yourself, and eventually they are going to support you. I'll give you a typical example just to conclude this part of community engagement. So community engagement, one thing is, you always have to look at win-win scenarios. I'll give you an example where we had a lot of struggle in terms of eye donation, eyeball collection. Till 2010, we didn't have almost local collection. We always used to depend on eye banks, which used to send donated eye from Indore and all. But 2024 onwards, we had very good support. There is an organization called Amar Jyoti, But then end of the day, I'll show you this picture. They do every year a program where they kind of call all of the donors of eye donation, because they're doing now almost every year they're doing more than 100 eye donations every year. So they do a program here. Particularly, I want to show you two pictures. One, if you look at the white shirt gentleman, he is the lead person of the Amar Jyoti Netra Sansthan, and next to sit to him is in the again the same round. He's a district magistrate of Satna. So now this guy is so happy because of Sadhguru involvement, because we had done something together. I'm able to sit with the district magistrate. I'm getting into a limelight. Now I'll show you another man in the circle. He is Dr. Gautam Paramar. He is the head of cornea department. He is also very happy because he get good corneas from through this collaboration. So what I'm saying is, end of the day, community engagement is not about you taking everything from the community. Like you go to somebody and say, let's organize a camp, and they support you. They will support you only if they also feel I'm also getting equally benefited. So how do you create situation like here? The organizers of Amar Jyoti are so happy because the district administration giving them a lot of respect because of the work they do. The Dr. Gautam Paramar at another end, the provider end, he's so happy because he's getting good quality cornea to do all terms of keratoplasty or whatever. So this is a win-win situations kind of. So community engagement, you need to ensure you are creating a win-win scenario, not just getting everything or giving back. So that's how you should go. But here again, I'm coming back to the point of engaging the outreach staff. Very important, I'll tell you, when we say we have vision center staff, we have outreach staff, a lot of things depend on us, how the organization project them. So for us, what we do is we always ensure they are in the front. Anything, even with a district level program also, we ensure those who are directly in the field are projected. Because if you see, if you try to project them, if you try to make them introduced to district level administration, district level health system, they also feel, our staff also feel, I'm getting a lot of respect, let me come up to that level. So sometimes it will do a mistake is you only send a senior to handle such a thing, and these people are not given an opportunity because of, not because of you don't want to give it, because you fear they may not be able to handle. But our policy is those who are in the field become the front runners. So eventually, I'll tell you, this is our own experience, eventually they become master into it, because Indians, like, usually if you see, if you raise your expectation bar, they will come there. So you should not limit. Grooming will have a lot of things happen with the confidence building. That will happen only when you give them opportunity. When you show them that I am trusting on you, I am really giving my 100% confidence on you. You do handle it, and they do that. The point is, every time you ensure you're keeping them at central stage, like be it recognizing a community sponsor, like when you do programs and all, we ensure that vision center staff is given a lot of importance, because many of the time you do the program, you bring many people from the hospital, this vision center staff is nowhere. So that will not help in the long run, because the next day you all will go back to hospital, this guy is going to be there. So if you project him that day, he is our important guy, he is the one felicitating people, so that memory, that connect will stand, and the long run it really helps. So that's what you have to ensure, because so that's what we do also. And apart from engaging them, giving them role, end of them, it also meant how do you reward. So there are many organizations who do incentive system, performance based increment. So I would say Sadhguru is very straightforward, where we have annual increment based on performance. Apart from that, we don't do any incentives and all, but we do ensure those who are doing, like, we do categorize our vision center, like, like according to our, like, 117 vision center, we have number of centers with operational excellence, those who are doing excellently well. We have a good number of centers who are doing just break even. Maybe we have few centers who have operational deficit, but according to the performances, we ensure there is an annual program, there is a 6-month program where even the director and the CEO is involved, giving them organizational guidance and also rewarding the people who are doing good. So this is where very important, because on a monthly basis probably we all meet them, but end of the day their performance is valued and rewarded at an organization top level. That matters a lot, and it no need to be always monetary. You can do a lot of system you can bring in place, but this is very critical and very, very important. So that is one thing we always focus. Apart from pushing with different aspect, we also ensure individual level the performance, because this is very important. I can tell you many vision centers are you know become successful. A large contribution is from the optometrist or ophthalmic assistant and the team, the CSW. So if their performance are not rewarded on time, somehow the motivation can go back. So this is where you need to ensure periodically you are reviewing, you're rewarding, and you keep watching on the vision center performance. And those who do excellently well, you need to reward in a very big platform, not just you doing it in a group or you doing it yourself. You have to make a program where it is happening. And not just rewarding, you also have to look at how they are performing. And at patient level, community member level, wishes and management committee meeting, you need to give them regular feedback. This is another aspect of it. Like when you say, I make them competent, I make them compassionate, I make them empowered, all of it is important, but you need one side to reflect and give them back feedback. And this is area you have to improve, because all of your vision centers, like 170 vision center in our case, not are in same line. All of optometrists are not on the same line. You need to somewhere keep improvising on their weakness, so that end of the day all of them come to a good level. So for that, we have at patient level, we do take feedback and share with them. We have QR codes where the patient do give feedback, and based on that, we give them feedback in a constructive way. And then every vision center, we are fortunate have committee, local committee, where volunteers and all these people are involved. So they do give us feedback in terms of how the centers are getting open, how the programs are running. Like outreach camps, you start by 9 and you finish by 2 o'clock. So we get information from outside also. Your camp run at 2 o'clock till 2 o'clock. Some of time people can come back faster, but it will not happen, because you will ensure it is happening in a way that it is really important. So I think apart from grooming them and supporting them, you also have to give them critical feedback, wherein which they can reflect on and improve. That's how it works. And I think in terms of, especially on Vision Center's journey, we are really grateful to all the partners. I mean, all of our Vision Center, when I say 117 Vision Center, it is only because of the partners. I put major partners, particular for Vision. Apart from that, we also have many partners working with us. Vision Center and outreach program, I think that's how it is very importantly it is running. And at the end, not as an end, but I'm saying it's also important. Like when you say I trust on everyone, but then we also understand not everyone is worth of it. Or like it is a case of an insurance. Nobody think we are going to die tomorrow, but all of us take an insurance. Similar, like you need to have equal competent system. Rather, you say I believe on my employee. You do have to believe on your employee, but end of the day, you need to have a backup system, or a system which vigilantly analyzes things in a very constructive way. Like in our case, like all of our vision centers are CCTV enabled. You can see this is today is like 2025. I just taken a screenshot of one of our vision center, which is in Attara, like Uttar Pradesh. You can see one of our optometrists is sitting there in the counter. I can watch lively from here. So a lot of technology, the app we use, all of the technology is really helping us. So end of the day, even I have 117 vision center, I can really see from here what is happening in my vision center, which is very important. I think, as I said in the beginning, and as I said even now, that we need to believe on our employee, we need to empower them, but we always have to ensure system is also equally efficient. This is again one thing. Like we have different outreach staff, so every day there is a report which comes to us, which even go to even top level, that who this person, who where are they now. It is like you have a big department, close to 400 plus staffs are there, but you will ensure there is a system which is very efficient to track people, motivate people, find out deviation, take corrective action. So this is happening because you are equally focusing on the system efficiently, not just focusing on employee engagement. So that also need to happen. So just to summarize, when we talk about empowerment of employee in outreach program, it is not an option, or it is not it's not a fancy word to use. It is an essential thing. Unless and until you empower, engage, community level programs are not going to be sustainable. And when you engage an employee, when you engage or when you invest in engaging the employee for the community engagement, you need to look at long term. And that will really help you in terms of building sustainable community focused IK program in a drive a lasting change. Or with that, I really wanted to thank Vision 2020 and my organization for this opportunity. And with that, I conclude, and I am very happy to take if any questions are there.
We have some questions.
Mhm.
So the first question is, how can technology, community engagement, and service delivery efforts be aligned with long-term goals for eradicating preventable blindness?
Yeah, good. I think Manojji has asked this question. It's a very important, like I didn't mention all of it in the PowerPoint presentation, but I think like one thing I have shown the CCTV, the live reporting our vision center performances. So community engagement, you see, we are, when you talk about community, it is a very remote thing. You are not seeing everything at your eyes, like unlike hospital, but technology play a very important role, be it screening, like all of our outreach camps are happening digitally. All of the thing data are captured live. All of the data are captured in the tab, and which simultaneously come to me. So anything like to come to the team. So let's say a outreach camp is happening and you're seeing the report, you're seeing 9 o'clock the camp started, and at 10 also there is only 10 registration. Immediately you call up and you see what is happening there. So that happens only because you have a live kind of a monitoring system. The CCTV thing I talked about, and the data integration, especially in terms of doing the research and everything. So it will really go along with. And I think technology play a very crucial role. We do take technology support at every end, be it data capturing, be it monitoring, be it analyzing the data, be it using it for improvement. All of the thing we do take that support from the technology.
Mm. Thank you, sir. The next question is, how do we reach out to local health government workers? A lot of them expect compensation from us based on our experience.
I think whenever you try to engage local healthcare government workers, one important thing you have to do a top-bottom approach. You can't really go to health worker. You have to go to district level. Like in our case, many a times what we done is we ensured district level administration is involved. Like we did cataract backlog free zone program, wherein we involve all the Asha Anganwadi worker, but through a district level approach where the district collector, he is driving the force. So when such thing happen, the compensation everything become very very less demanding, because it is a district level program, as a government driven program. So somewhere like when you have to engage them, if you go for a top bottom approach, you'll have more. I mean, I won't say 100%, but then the resistance from the ground level will be very less if you come with top bottom approach. If you engage the top authorities, and you kind of create a holistic mission together, so definitely they take part without really talking about compensation.
Okay. Thank you, sir. The next question is, Vision Center patient case sheet is registered with the base hospital.
This is called integration. We are currently we are working on it, and our at present our we have an EMR which is in the vision center, but the hospital EMR is not fully functional. So with that reason, we do have a mechanism where we ensure that those who are registered in the vision center will not do registration again in the hospital, but it is in the process of completion.
Okay. Next question is, Vision Center staff goes outside the center for screening. How frequently and what sort of screening?
Vision center staff do go for community screening, especially for awareness creation. But then most of the time you'll have a surplus manpower which rotate. So what happened is this vision center staff, they go to field, one, to understand the reality, second, to get more familiarity with the field, third, also to create awareness about the vision center. But you always ensure vision center is backed up by somebody in the center to take care of. But point here is, when we send optometrists to field, we'll have another optometrist in the vision center, but we do send the vision center staff outside. Not like external person will go to community, because we need the vision center local person need to communicate, to travel around, so that he get the feel of it, he take the ownership of it. So that's how it goes.
Okay. How you manage the supply chain and biomedical maintenance?
So in our case, we have 117 vision center, and we also have an outreach network. We do good number of outreach camp, those who don't have vision center. So most of the time, our vehicle keep moving on at a different end. So like even this helps in to ensure our biomedical team is going to vision center. They have a routine preventive maintenance schedule, which is many of the time get combined with vision center audit team, vision center quality check team. So it is a comprehensive approach where you'll not go alone for just managing the vision center equipment. So it is a comprehensive approach.
Okay. So next question is, what are the key parameters to regularly monitor for effective running of vision centers?
So every vision center, one important thing is how end of the day you make it sustainable. It is not to earn, but I'm saying your competency need to be there. So you need to look at number of new patient coming there, how many people are getting prescribed by the refractive error, how many people are taking the spectacle from you, because that will give you a lot of insight. You don't need to push anybody for spectacle, but end of the day that all will talk about how much capable, how much quality way you are able to give your services. So you need to look at the inpatient outpatient flow. You need to look at the spectacle prescription versus dispensing. You need to look at number of surgery to be referred and attending in the base hospital. So there can be a quite good monitor to ensure your performance is at par.
Okay. How to change the behavior of a community where people are not at all serious towards the eye health care. They reports when they almost lost their eyesight. So how to aware to such community? Please suggest some of the strategies.
No, see, I think all of, like, we are at one point now, but wherever we are started, there was the same case that people were not aware of. But this is up to you. How do you really bring, as I said, when a community have a problem where they are not really conscious, or they are not really positive about it, you may have to run a campaign with the government, with the local leaders. Probably this community is not sensitized, but they might have sensitized in many other programs. So how you need to look at other successful model. With that model involvement, you'll get a lot of practical insight. How do you really take your things to forward?
So, for top bottom approaches, those authorities have their own hospitals, so they sometimes do hesitate to send patients to our hospital. So, what to do with that?
So you don't need to compete. I mean, I think blindness is like an ocean, and if they have, like, in this, I think they are mentioning about district hospital. If the district hospital are able to do good number of surgery, let them do that. But then you still have a good proportion which is waiting for service to be availed. So even in our case, like even our district hospital also do good number of surgery. We don't really look at them as a competitor. We do support, in fact, their surgeon to get trained, their ophthalmic assistant to get trained, and it is not going to be a problem in the long run. If your system are in place, you are really doing a good job. I don't think there will be a friction in terms of doing that.
Okay. Are there any recommended tools or softwares for tracking patient data and follow-up care in community settings?
Yeah, there are a good number of vision center softwares are there which will help you in terms of tracking the patient data, follow up care in community settings. Like most of our vision center do cataract surgical follow up. So end of the day, in a click, I'll get to know how many patients got operated from how many vision center, what is the follow up rate, why it is low or high. So there are many software. Even we have our own software. You can connect to us separately. I think even Arvind does it, LV Prasad does it, Shroff. I mean, almost all. There are many tools available. Probably you can connect to Right to Vision 2020 also. They might also suggest some good recommendation.
So, what's a mode of income in Vision Center for Sentability?
Vision center usually, like, there are two things. One, mostly the vision centers are sustained with the registration, then the spectacles, and then the surgical income. Like, when you refer a patient to a hospital and they go for a good surgery or even for a free surgery, some proportion of that should belong to vision center. So with that three income, like registration, then the spectacles, and then the surgical income, you can sustain the vision center.
Do you have the teleconsultation facility to all 100 plus centers connected?
No, at present, no. We have teleconsultation to our advanced clinic. Reason being two things. One is, most of the area, the optometrists, those who are sitting there, are considered to be a doctor. They are optometrists, but in the field, if you give a very impression of, doctor is sitting somewhere here, an optometrist is sitting, and basic vision and refraction, you only need an optometrist. But we do have a system where all of optometrists can take advices from the seniors, even from the doctor, once doctor sit in the hospital. But we don't do as such a teleconsultation to all patients. This is an institutional policy. We don't do teleconsultation for all cases, only for required cases. And those who have advanced clinic, like I said, the fundus cameras, and there we do teleconsultation for each patient with fundus photography. But otherwise, we do teleconsultation as and when required or suggested by the vision technician. So in principle, we do have teleconsultation facility, but we don't really do for every patient.
Okay. What camp staff manpower used to get your achievements in hospital except VCC now? How to maintain patient flows at vision center?
That is, you need to engage the community. End of the day, community need to be really engaged. You need to create a good awareness about the program. Your staff should be competent enough to do a good quality refraction and do a good slit lamp evaluation. So that's how it will work.
Okay. How to improve OPD in vision center nearby main hospital, like Karbi Vision Center?
Karvi Vision Center, we have an average of 18 to 20 Vision Center per day. So, see, end of the day, like I always remember in Aravind Eye Hospital, Madurai, in front of there is a eye hospital running. They still do sustainably. They are in front of Aravind. I think almost everywhere you will get good patient if you, because you know, everywhere you will have a different set of mindset. Like in Karvi, like people say, I'll not go to Sadhguru, it will take time, it is a big hospital, let me go to their small center. So you will have different mindset people, and everyone, like for us, like in a vision center, 20 OPD is something like an average we maintain. That is easily it is happening in Karvi Vision Center. So there, as again, everything matters on how capable your staff are, how empowered they are, and then how much awareness you create in the community, and how capable your system to ensure patients are given satisfaction at their services.
Okay. So next is all your 100 plus centers are operationally self-sustainable, and how
Yeah.
long it take to become self-sustainable?
Fortunately, all of our vision centers, or I mean, I would say one or two session, probably the new centers I can't really count on, but otherwise, all of our vision center come into a sustainability within 1 year period of time. And we have, like as I said, like usually the big figure we keep it 3 years, but 3 years we say by the time of 3 years, your center should be sustainable with registration and spectacle. But with the surgical load we cater, within a year time, you can really become sustainable. But let's say in the normal way, every vision center should ideally look at 3 years of time. By the time they should be totally sustainable. So for us, like within 1 year, we wanted to sustain our system through surgery, spectacles, and registration. Within 3 years of time, we wanted to sustain our vision center through registration and spectacle alone. So that's how the model we work on.
Okay. What is a manpower requirement for one vision center, and how many days do you keep the vision
We
center
keep our
open?
vision center 6 days open, and vision center need two manpower. Ideally, we should have two manpower, one for the community and one for the vision center. And certain vision center where when we increase the number from 25 and more, we'll have two manpower in the vision center, one junior and one senior, and then one person in the field also.
Okay. For vision center, do doctors visit the center? And if not, how can optometrists prescribe for basic problems such as congestion or something?
No,
So,
so doctor don't visit. We do teleconsultation, as I mentioned. Doctor visit for a quality purpose, like quality audits and all. Sometimes we do send doctors to assess them, their competency, their confidence level, and everything. But otherwise, you always have a network of seniors. You have your own system. Like when we talk about our ophthalmology department, community ophthalmology department, we have layers of administrative hierarchy where people know whom to approach and how to really solve their problem, not just the clinical problem, the managerial issues and everything.
who will prescribe medicine in case the patient has to manage with medicine only?
No, basically vision centers are not advised to prescribe medication. We have higher clinic, like in between every 10-15 center we have a higher clinic where we do have teleconsultation full time, as I mentioned. There we do have a pharmacy which is aligned with us, so there we do prescribe medicine with the doctor consultation and doctor prescription. It's not the optometrists do that.
Okay. One more question. Patient flow will improve with more community camps, but that time our vision center staffs are out of camps. So who
This
will
I
take care?
mentioned already. We have staff who goes in rotation. Like end of the day, if fourth day of that month, a vision center is doing a camp, so you will have an optometrist who is running. Like you are circulating. It is like you have 5 to 10 manpower who are standby. So they go in rotation. They are called replacement. They go for replacing the vision center, and the vision center staff will go for the camp. So center will not be closed, because that impression you should never give, that you have no idea when the center will be open or closed.
Okay. So can we get a how to operate the vision center? Any guide or any Seva Samaj help in that?
Also, Vision Center, there is a good manual which recently come up with Vision Center 2020, where all of our input had Mr. Daniel and everyone is really did a wonderful job. So I think that maybe you can connect to Vision 2020 and get that.
Okay. And one last is, what should be the ideal monthly salary of a community health
So
worker?
it depends on the region. You need to always look at, if I say, if let's say in a context we say you should give, this is what salary you should be giving. But in the community, the wage is really above that. You won't get the person. So it is totally, it is really regional and local. You need to really look at your local situation and pay the salary.
So we are concluding the webinar. So thank you all for attending to this webinar. So we appreciate your time, engagement, and thoughtful questions. A special thanks to our speaker for sharing their expertise. We hope you find the session valuable and look forward to seeing you at the future events.